So good afternoon and welcome everyone. On behalf of the East Bay Community Foundation, it is my honor to thank you and welcome you, and thank you for making time to be with us today, especially amidst the physical distancing that we are all experiencing. It's great to be in community with you today, even virtually. My name is Amy Fitzgerald. I'm a senior program officer here at the foundation, and I'm going to be moderating our conversation today. Today we'll have an opportunity to learn how the East Bay Community Foundation is responding to the coronavirus pandemic, specifically through our COVID-19 Just East Bay Response Fund. We'll hear from two of our incredible fund holders here at the foundation, Tom Ellaby and Paula Mathis, who will share how they're thinking about their giving during this particular moment. And we have the honor of hearing from two of our powerful community partners, Dr. Noha Abaleta from Roots Community Health Center and Rhea Laughlin from First Five Contra Costa, about their efforts to support individuals and families amidst the crisis, as well as their thoughts on how we can begin to redesign and reimagine public systems that will be just and equitable for everyone who calls the East Bay home as we reimagine and rebuild our region. First, a couple of notes on housekeeping. Our moderator has all of our participants on mute in order to reduce background noise. We do encourage you to ask questions throughout our conversation, and you can use the Q&A box that is at the bottom of your screen to do that as each one of our speakers is sharing. We do have time at the end of the webinar to address questions to particular individuals or just overall that you might have. So please fill up that Q&A box for our Q&A session later on. And we will be sending out a follow-up email after the webinar with the information that you've heard today, as well as any links that might be shared. So, rest assured that you will receive all of this information in the next day or so as well. So without further ado, it's my pleasure to turn it over to James Head, the President and CEO of the East Bay Community Foundation. Take it away, James.
Thank you, Amy. And also good afternoon, everyone. It's so good to have you all with us for this virtual town hall meeting. And I'm really excited for the conversation we'll have and for questions and comments that you may have. As Amy mentioned, my name is James Head, and I'm the President and CEO at the East Bay Community Foundation. And I work in an organization that has great staff and board of trustee members, donors, institutional partners who work with us to make the East Bay a better region for all of us. I'd like to just make a couple of opening remarks, but before beginning, would just like to take a moment to really acknowledge the essential workers that are making extraordinary sacrifices for us to keep us all safe, fed, and healthy, from the doctors and nurses and other health care workers on the front lines to the workers in the grocery stores, public transit, mail carriers, and sanitation employees, all of whom are allowing us to shelter in place in our homes. I'm sure you would join me in offering our sincerest gratitudes to them for their selfless work and service and their sacrifice. I also want to thank many of you who have contributed to our COVID-19 response fund, and really want to especially give a special thank you, actually, to the East Bay Foundation on Aging, who's our partner in service of the elderly and who made a significant contribution to the fund to ensure that we can provide support for that population. You'll hear from a couple of our fund holders, Tom and Paula, in a moment, but your sacrifice, your resources, your participation just can't be understated in terms of what it means to the community and to those who are currently in need. It's probably and perhaps an easy thing to say that no one is immune from this pandemic. But what we are beginning to learn as the data comes in is that certain of us are actually much more susceptible to the detrimental impacts and effects of this pandemic than many of the rest of us. And that is why the East Bay Foundation has felt that we, as well as others, have needed to respond. And you'll hear a little bit more from Amy and others about our specific targeted response to make sure that those who are in need have the income and the resources to sustain themselves in the short term. And we're beginning to also think about what the long-term recovery and what resilience would look like as we go forward. I want to be clear in saying that we will get through this. I fully and totally believe that, and believe that we will get through it together. And I think that this current environment that we're in does offer us a real opportunity to rethink how society functions and how we really interact and how we support those who are most vulnerable. And I think some of that conversation we'll have today as you hear from those on the front lines who are doing this work. And so I really am excited about the fact that you all are with us. I'm excited about the fact that many of you have stepped up to contribute. I hope that those of you who haven't had a chance to do so will think about that and will join us in the effort to support all of our community members who are fighting their way through this pandemic and through this effort. But let's get on to hear what we're doing. So I'd like to now turn it over to Alexandra Aquino-Fike to talk about our response.
Thank you, James, for that introduction. Good afternoon, everyone. My name is Alexandra Aquino-Fike, and I'm the Vice President of Development here at the Foundation. I've had the honor and pleasure of meeting many of you in person prior to today, but for those of you whom I've not met, I really hope we can connect in person once this crisis passes. I'll be very brief as I want to introduce to you two very special EBCF family members who will share their story about why they chose to support our COVID-19 fund. But first, I want to echo James's gratitude to you all who've so generously contributed to our fund or who are thinking about supporting our community in other ways. When we began thinking of setting up this fund, we really weren't sure what the response might be. But I have to say we've been completely overwhelmed by the outpouring of generosity from both longtime EBCF fund holders, new donors, folks who live in the East Bay, and folks who live in other parts of the Bay Area and beyond. Starting in March, we began to receive daily calls and emails asking, what is EBCF doing for our community here, for our region? I want to do something. How can I get involved to support the response and recovery? Your trust in us and your desire to give back to those who are hurting the most as a result of this crisis is truly inspiring. When we at EBCF began to understand the magnitude of this crisis, especially the economic impact and who was going to be hit the hardest, we began creating the COVID-19 Adjust East Bay Response Fund. Our board of directors unanimously voted to draw $1 million from our endowment to seed this response fund. As a community foundation, we're lucky to have a unique set of relationships with community-based organizations and generous individuals, families, local businesses, and foundations. We also knew that our various stakeholders were similarly disturbed by the impact of the COVID-19 crisis, both the health and economic impacts, and were eager to be involved. For many of us working remotely, participating in the creation and growth of this fund has given us a sense of purpose, an agency, a way to do something in the midst of an invisible war. This fund has also become a way to feel part of something positive in the middle of so much fear, anxiety, isolation, and to be part of a community that cares deeply for those in need. I'm so proud to announce that to date, we've raised over $3.3 million in resources for our COVID-19 response fund, including our own $1 million contribution as a foundation. A significant portion of the resources raised has been from individuals and families or supporting organizations that we house, like the East Bay Foundation on Aging. And as you may have seen in our recent communications, we've already granted out about $1 million to frontline organizations, some of whom you'll hear from today. We're thrilled at our progress to date with the response fund, but as you can imagine, the need is so far greater. And right now, Our goal is to raise at least $5 million in response funds to help the most vulnerable communities in the East Bay weather this crisis, not just in the immediate term, but over the next 1 to 2 years. And given your responses and support to date, I believe that we can not only raise $5 million in support, but exceed it. I hope that after hearing from the experience of our fund holders, Paula Mathis and Tom Ellaby, and our community leaders, that you will feel compelled to make a personally significant gift to our fund if you haven't already. And if you've already made that gift to date, thank you so much. Times like this ask all of us to be courageous and bold. And as I mentioned before, we are so inspired by the positive response and the engagement of generous donors like you all. We're thankful to have two of them with us today. Paula and Tom have been with EBCF since 2016, around the time they moved back to the Bay Area after many years in Southern California. Paula and Tom have been retired from their respective careers for many years now, but one of their big focuses is on making a positive impact in their local community through philanthropy and through nonprofit volunteer service. In collaboration with EBCF, they've targeted their giving to meet their interest areas, including early childhood education and strengthening African American communities. They've granted to organizations they've known for years and trust, and they've granted to new organizations that EBCF has introduced to them, and they've supported EBCF's own initiatives to, like our work to increase public spending in the early childhood education arena, or our Ascend BLO initiative that strengthens African American leadership and nonprofit capacity. Paula serves on various local nonprofit boards, such as Bananas and the Child Care Law Center, and is on the advisory board of Help a Mother Out, a diaper bank. Tom serves on EBCF's advisory board for our Ascend BLO initiative. I'm so grateful to Paula and Tom, not only for their generous contributions to our COVID-19 response fund, but also for taking the time to share their story with you all today. I'll let them say a few words now about their experience and why they chose to partner with EBCF in this initiative. Thank you, Paula and Tom.
It is our pleasure to participate. I will say up front that my wife and I are usually very quiet donors. We don't seek any publicity. But this time is different. When the acts came, we had to respond with a yes to the East Bay Community Foundation to participate in this forum. We are from Southern California, and we moved our fund from the Orange County Community Foundation up to the East Bay Community Foundation, and we found that we needed the guidance of James and his team to help us identify and help others. They've been outstanding in all the work that they've done with us, and I trust them completely. I look forward to their guidance, and I encourage all of us that are on this call today to lean toward what they bring to the table. They're right on top of everything that happens in our community, and I have never gotten a recommendation that I've been sorry about. So with that, I'm gonna have my wife, Paula Mathis, tell you about our path forward.
Hi, thanks, Tom. So Tom and I have been thinking deeply about our philanthropic activities since this started. And about 2 or 3 weeks ago, we had a discussion and decided that now was the time to give as much as we possibly could. We've had a fund at either the Orange County Community Foundation or the East Bay Community Foundation for many, many years, and have consistently made grants from that fund and have consistently been able to add more to that fund. But we've always kept a fairly high balance in the fund. And in our discussions lately, we've decided that if we don't spend that money down now, when are we going to? The need is so great, something that we have never seen in our long, long lives. So we've decided that over the next month or two, while we need to get some things organized, we probably will spend or give away 90% of what we have in that fund. The other thing I want to talk about is why we're doing this through the East Bay Community Foundation and not just making the decisions ourselves to give, which agencies to give. We do some of that because we have some agencies that we've supported for a long time and we value their work. But the need is so great and the money needs to get to the people that need it the most through organizations that can do the best work and help them the best. And we don't know all those agencies. We don't know all the ways that people are working. We don't fully, I think, understand all the funds that are coming in and who's getting what and who isn't. But we believe strongly that the East Bay Community Foundation knows that, understands that, and will take the best actions with our money. So to echo my husband, if you can give, dig deep, that there's no time like the present to give, and we intend to do all that we can to help our community. Thanks.
Thank you.
Thank you so much, Paula and Tom. I just deeply appreciate your partnership, your trust, and insight as fund holders with EBCF. And I'll say on behalf of our program team that, you know, we felt deeply as our donors have been stepping up, and the many conversations that we have had with community partners, you know, a charge, an obligation, a mission to respond to our community in a way that would make our donors proud and really make an impact and an effective response to partners across the East Bay. So thank you. I mean, I'm really moved by your words, and it's, you know, my opportunity now to give folks an update on how the grant making itself has rolled out. So in early March, as we began to have a sense of the impact that the pandemic was going to have on our communities, the program team started reaching out right away to our core grantee partners to get a sense of both how they were seeing the impacts on the communities that they work with, as well as how their organizations were being impacted by adopting and adapting to shelter in place. In about a week, we had roughly 30 conversations with core grantee partners across Alameda and Contra Costa counties. And those conversations really became the foundation for our COVID-19 Just East Bay Response Fund grant-making strategy. So first, in terms of priority populations that we wanted to highlight and really prioritize with our grant making, and I'm gonna ask Sam to advance to the next slide. We wanted to make sure that we were able to provide resources to vulnerable populations who were unlikely to receive any sort of state or federal support, and particularly given both their unlikeliness to receive that and also the long time window that it was going to take for those resources to roll out. So the populations that we are prioritizing in our grant making strategy are here for you to see. They include undocumented immigrants, unsheltered communities, those who have been employed in the cash economy like day laborers and domestic workers, folks who are uninsured and underinsured in our counties, young people of every age, victims of domestic violence, low-income seniors, and the formerly incarcerated folks. These populations we delineated really right in the middle of March, and you have actually seen as stimulus packages have rolled out, many of these populations being excluded from that type of public benefit. Our grant-making strategy has four funding categories that you can see before you, and I want to give a little bit of context for each of those, a little bit of texture. The first one being direct financial assistance to individuals and families who are experiencing economic hardship. In those first conversations with grantee partners, when we said, what are you hearing, what are you seeing? The very first thing people said was, families need money, period. Families are experiencing decreased work hours, inability to pay rent, can't pay for medication, adapting to education at home. Families need resources. That's not really a place really that EBCF has funded in the past. In fact, not a lot of philanthropy has funded in that way. So we mobilized very quickly to provide resources to core grantee partners who had deep, long-term networks of relationships with individuals and families in Alameda and Contra Costa County. We really trusted our grantees to identify families and assess their financial needs. And for organizations that had the capacity to provide that financial resource directly, we provided them a grant to go ahead and do that. Some grantees wanted to partner with an intermediary to actually distribute the funds. So in that case, we were able to kind of hook those two organizations up so that funds could flow accessibly to community members without a lot of process and or need for kind of additional steps along the way. You know, one of the benefits of working with our core community organizing grantees, and you'll hear from Ria in a moment, in this way, is that they have deep and abiding networks of relationships with families. They've been working with these families before coronavirus. They will continue to be in relationship and work with these families once the pandemic has kind of, I can't even say ended, but as we continue into the future of our region. So, you know, these resources and these relationships will go on and be sustainable, and it is less of kind of a one-off financial transaction. The second category of funding is support to frontline organizations who are providing essential services to our priority populations. So these organizations are doing everything from food distribution to outreach to unsheltered communities, to mental health support for people who are experiencing domestic violence. And these services are more critical than ever as many of these conditions have been exacerbated by shelter in place and the pandemic itself. And you'll hear more from Dr. Noha about that in a moment. Next, we're going to be moving into grants, general operating support grants to current grantees to help them weather the many and varied changes and challenges that they're experiencing due to the pandemic and shelter in place. So organizations are going above and beyond to adapt to working remotely and maintaining all of their services and programming. And so we wanted to give them some flexible support and trust that they will know how to best use that support for their organization. And finally, it's important to us to ensure that our COVID response grant making continues to reflect and align with our long-term justice-based strategy by allocating funds for organizations who are leading impressive community organizing and systems change campaigns on the local, regional, state, and even national level. These are the stories you see about eviction moratoriums, rent freezes, reducing the incarcerated population to protect folks from acquiring COVID-19, protecting essential workers, ensuring paid sick leave, advocating for additional resources at the federal level. I mean, these organizations are busy and they are really, you know, they're really challenging this notion of what it will mean to get back to normal. Because we really know that the normal we have experienced has never been just and equitable for all of our community members. And what we have in this crisis is really opening a window to reimagine and rebuild public systems and structures that will really reflect the dignity of all people and ensure health and safety and security for our communities. So this type of organizing and policy change work will lead the charge on that as we move forward. Some quick numbers for you. So in just 3 weeks, we have made 64 grants that total just shy of $1.75 million in grants out to the community. So as our fundraising has come in, we have been moving those resources out into the community as quickly as possible. And so I think you can see here kind of each of our 4 categories, how the grant making has played out amongst those categories so far, really prioritizing in this early grant making the direct financial assistance and the support for frontline organizations. And most of our grants have been between $15,000 and $40,000, so some significant resource to community partners on the ground. And now it's really my honor to introduce 2 of our community partners who have received support from the COVID-19 Justice Bay Response Fund. Dr. Noha Abaleta is the CEO of Roots Community Health Center in East Oakland, and Ria Laughlin leads the community engagement and advocacy team at First 5 Contra Costa. They're both going to share their insight about how their organizations are responding to the crisis, as well as how we might emerge stronger together in the future. And I'm going to go ahead and remind you too to drop questions that you might have into the question box. And with that, I'll turn it over to Dr. Noha.
Good afternoon, everyone. Thank you so much for having me. So my name is Noha Balada, and I'm the CEO and founder of Roots Community Health Center. I founded Roots back in 2008 to address really wide and longstanding health disparities, particularly for African Americans in Oakland. So at that time, life expectancy for an African American male was in his early 60s. And that's about 20 years shorter than sort of the average for the county. And much of that was due to hypertension, cardiovascular disease, and just premature death from preventable causes. And unfortunately, we're seeing some of that as contributing factors to some of the disparities we're seeing even with this pandemic today. So Roots was really addressed in the first place to sort of address some of these community level and population level disparities. We started as a 2-person volunteer operation in 2008 and hired our first person in 2013. And now we're at 120 full-time staff across 10 clinical sites and 2 workforce sites. And so we're really working on the front lines of this pandemic. We're providing healthcare, including COVID testing, behavioral health care, and also resource distribution like food, diapers, hygiene supplies to our vulnerable community members. We have 2 full scope primary care sites in Deep East Oakland and 1 in San Jose. And then we also have 3 satellite sites. One of those is a mobile clinic that goes out to Oakland's encampments and provides medical care at the encampments. And we're doing testing at those locations as well. And then we also operate 2 satellite sites within youth shelters. And so serving marginalized and commercially and sexually exploited youth within youth shelters in Oakland. And we also provide the student health services for our community college district, which we've relocated to our site. So we've had to pivot sort of almost everything that we do. I don't think there's a single area of our organization that has not had to pivot in response to this crisis. We've moved all of our non-sick visits and non-crisis visits to video or telephone. We maintain a crew at each of our sites to receive sick patients and do testing, and also to distribute grocery bags and hot meals. We've probably quadrupled the amount of basic resource distribution we're doing. So we're now distributing about 800 grocery bags, either to people picking them up or we're delivering them to their homes, especially our more frail or complex patients. We're doing home box deliveries of food and resources. And we're distributing about 1,000 hot meals a week as well. We're really working hard, I think, to sort of mitigate what we've anticipated from the very beginning of this pandemic, as anticipated sort of disproportionate impact on the community that we serve, both, I think, due to the virus itself as well as the economic fallout. And so I feel like we're sort of responding and preparing at the same time, sort of during this crisis. We're really proud that we've been able to maintain 100% employment of our staff, and we're actually continuing to scale up and even hire during this time in order to meet the needs. Roots also operates 2 social enterprises, which are basically a response to the biggest barrier to good health within our community, which is poverty itself. And so we do sort of employment and training. And it's sort of, we have one of our social enterprises that's called Clean 360, where we make natural bath and body products, and we train folks who've been marginalized from the workforce, sort of in soft skills and the hard skills of manufacturing. And we've pivoted that to be making quite a bit of hand sanitizer. And so we're really proud that we've been able to maintain training for our community and employment and meet a critical need. The city of Oakland is actually one of our main customers, and so we're supplying the Oakland Police Department and Public Works with hand sanitizer. So we're really proud to be able to mobilize our essential staff to be able to meet this need. So I think our frontline staff are incredible, putting their bodies and their lives on the line every day to help us get through this crisis. And so we're just so grateful. We hire from our community, we train within our community, and we have incredible, talented staff that are dedicated and committed to being of service. I think as we think about some of the structural, I think, issues that are kind of being laid bare at this moment of crisis. And we look at all the areas where we have concerns. Those include some of the institutions, like our jails and our prisons, where looking at sort of the responses there and what it means to be released into communities during a complete economic shutdown, and where there's outbreaks in institutions and so forth. And so trying to prepare and respond to those. But as I take a step back and just think about sort of the lack of preparedness, I think, nationwide, from a public health infrastructure standpoint, and how that is putting such an undue strain on our healthcare delivery system, which is really probably one of the best in the world, but obviously has a finite capacity. And so as we think towards the future, I think it's tremendous to see public health leadership stepping up and making hard decisions. And I feel so grateful to be here in the Bay Area and in California, where our public health leadership has gotten out ahead, I think, of many other regions, and enforced some of the shelter-in-place orders and others to keep us safe and keep us protected. And I think it just underscores for me sort of the need to be thinking about what a strong, responsive, and prepared public health infrastructure really looks like. I think for us, the bright spots, if there are some, and then there are I think moments like this, to be able to to know that there's support out there and people that are thinking about those of us on the front lines, and also thinking about how we do better at sort of connecting dots and breaking down silos and creating new partnerships and new relationships. And so we feel really blessed to have formed many new partnerships, both on the front lines and in terms of having the kind of support needed to, I think, not only deliver critical frontline services, but also to make sure that we are advocating for systems that are just, and that we are anticipating and highlighting and exposing and mitigating disparities, not only from this pandemic, but also from all the other epidemics and disparities and crises that this is sort of layered on top of. And so I think we're trying to find those opportunities to sort of take this moment, see what's being highlighted, and ensure that when we come out on the other side of this, we're stronger for it.
Thank you, Noha, and good afternoon, everyone. My name is Ria, and I'm with First Five Contra Costa with the Community Engagement and Advocacy team. And I really appreciate the opportunity to speak with you. And I'm really grateful to all of you for the thoughtful approach that you're taking to funding and supporting vulnerable communities through this crisis. We all understand the value of centering directly impacted residents and their leadership in our work. And in that vein, I'd like to share with you how this pandemic is impacting Contra Costa communities and what we're all learning about how to best respond and be of support. So for the last 17 years, I've been working alongside low-income immigrant families and families of color in our program to build healthy, safe, and equitable communities, primarily through the areas of housing, park access, and immigrant and racial justice. We organize with over 200 volunteer parent advocates who have their finger on the pulse of community need and as well as solutions. And after years of tirelessly fighting for their communities, now these same families are being knocked down and are really struggling with the full scope of this crisis. And to give you an idea, 96% of the parent leaders are suddenly unemployed or experiencing severe work reductions. 70% of them are ineligible for public benefits. And the financial assistance needed to cover their expenses to date is over $80,000. So not only are families finding themselves thrust into full-time childcare and homeschooling, plagued with fears of getting sick, but parents and children alike are under extreme financial and emotional distress. Parents' primary concern is how to pay the rent, how to buy food and medication. And next week marks the second month that rent is due without income coming in to pay it. So parents are extremely worried They ask about what happens if they get evicted, how much debt will they accrue, and what will happen to them and their kids if they get sick. But even in the midst of this stress and hardship, the parent advocates have summoned their leadership and been a voice for thousands of families across the county. Just within the first couple of days of the shelter in place, we began discussing what policies were needed to offer protections, and their answer was very clear: eviction protection and debt forgiveness. So a week later, we were before the Concord and Antioch City Councils advocating for emergency eviction moratoriums. We quickly learned that they are nuanced ordinances, and we learned how to make sure that they guarantee optimal protections. And then the families got to work. They started writing their testimonies, meeting with council members through Zoom, and mobilizing residents to participate virtually in city council meetings. And less than 6 weeks later, I'm really happy to share that 6 Contra Costa cities have passed eviction and rent increase moratoriums. And 2 days ago, the County Board of Supervisors passed a countywide ordinance covering all 19 cities. So we certainly have more work to do to pass policies and direct resources to communities in need. But this crisis is reinforcing and highlighting a few lessons that we know to be true. And the first is that existing inequities and vulnerabilities are only exacerbated in moments of crisis. Not everyone is impacted equally or equitably by this difficult time. We know that low-income families of color, and in particular African-American families, Latinos, immigrants, disproportionately bear the brunt of the financial and health consequences of this crisis. The second is that we know we're most successful when the most impacted members of our communities lead us. And while the passage of 7 policies in 6 weeks undoubtedly could not have happened without partnerships with allies and coalitions and key elected leaders, it was the residents that led this effort. And we are really most successful in any advocacy effort when we work in partnership with impacted residents and are grounded in our values of community-driven organizing, cultural humility, and equity. And the third is that we know that groups with existing organizing mechanisms and infrastructures are able to respond most effectively in moments of crisis. Had we not had investments in our program over the years, we would not have been able to pivot and respond quickly to this crisis. We were poised to move with power immediately because for years we had built a mechanism to organize, foster relationships with council and allies, and implement our proven model for community-driven advocacy. And like most organizations, we certainly have struggled during this time, but the long-term consistent investment in our work over the years really allowed us to respond and continue to respond to this crisis very differently. So we know that the impact of this crisis will be felt long into the future, and we know that it will continue to fan existing inequities. It makes it that funding our work across the region that puts directly impacted community leaders at the center becomes more important than ever. And I would just also say that, as I'm sure we're all aware, that the need for partnerships and coming together, especially now, across our different disciplines, whether it's service delivery, advocacy and organizing, or philanthropy, it's really important to be in partnership with each other, ground ourselves in our values of advancing the leadership of impacted communities. And I really believe when we do this, we not only can recover from this crisis, but we can transform our communities for generations to come. So thank you, Amy and East Bay Community Foundation, for giving me time to share our work, and I'll be happy to answer any questions you may have.
Great. Thank you so much to Ria and Dr. Noha, lifting up the work that they're doing, and you know, just having the insight to both be responding to critical emerging need, as well as kind of their leadership in thinking forward, and how, you know, we are experiencing a universal moment, a global moment, really. And for some folks, this is peeling back a layer into the significant disparities that we have in our community. This is, you know, I'm reminded of a quote that talks about, you know, crisis doesn't change who you are, reveals who you are. And where our communities are being revealed in different ways. And it's our goal to really step up and lean into what Ria and Dr. Noha have really highlighted in terms of partnerships, new opportunities, and really ways to move forward together towards really what we have called it at the East Bay Community Foundation, a Just East Bay. We have some time for questions and answers. I've seen 2 questions in the chat box or the Q&A box, particularly related to organizations who might be in need of funding support or who are doing work in response to the crisis. Anyone who has an inquiry regarding funding support should send that to grantmaking@eastbaycf.org. As you've seen in our first round, we've gotten out about half of so far the funds resources. We are doing subsequent rounds of funding. We did begin with existing grantee partnerships so we could move funds as quickly as possible. And we are consistently putting together those inquiries and tracking all of the inquiries to identify organizations that are kind of inside of the categories that we have delineated for our grant making strategy. So again, inquiries regarding funding should email grantmaking@eastbaycf.org. Are there any other questions that folks might want to offer in the Q&A? And as people might be typing those in, I'll turn back to our panelists to see if anyone else has something burning on your hearts that came up as we were talking that you might want to share as we're potentially waiting for some Q&A to come in. Okay, I have 2 other questions in the Q&A that I'll refer to. So Karen Couric has asked us, you know, we learned when folks have donated to the Go Public Schools COVID funds that individual distributions are often limited to under $600 per family. Could we comment on this? So this is a bit of a technical question. I think I could just do it justice really briefly. And then happy to follow up with more detail via email if you'd like. So there are some restriction regarding the cap of direct assistance that is available. That cap actually gets lifted during moments of emergency and crisis that are, you know, federally designated as such. So it does lift that somewhat. These are kind of pretty technical, like finance questions that our finance team could actually probably answer very, very quickly. But so one is that cap on an individual organization does get lifted in the midst of a crisis. The other option, which is the option we pursued mostly, is partnering organizations with intermediaries who are experts in resource distribution to families. Those folks have all of the existing infrastructure. I'll give them a shout out. We've partnered with Community Financial Resources and the Family Independence Initiative. Those folks have years of experience in infrastructure on distributing those resources, and they know appropriately how to indicate those resources as gifts, which also changes the amount that you're able to give underneath the IRS regulations. So that's unfortunately a program officer's response to that question. A finance person would probably have a little bit more detail, and I'm happy to follow that up. But our overarching lesson for us was to partner with intermediaries who really had significant experience in how to distribute resources, all the while complying with all of the particular regulations. Okay. Sorry about this. I'm wondering, Alex, if you might be able to talk about, some of the positive trends that we've seen with our donors in the past week or so, that other donors might, consider continuing over the next few weeks. So some of the, what we have heard from our donors and how others might be encouraged to act similarly.
Sure. So, one interesting point or fact is we've had about 210 donors to our fund. 200 of them have been individuals or generous families. And so I think it really shows also I would say about half of what we've raised has come from individuals. And the other half has been a combination of corporations and foundations. So I think it really, these results really speak to just the power of the generosity of individual DAF holders or supporting organizations and people like you all who are on this call today. And so I would encourage you all to, if you're thinking about, getting involved in the response, that please continue to do so. And you can reach out to me. My email is on our website. I'll also type it in here in the chat box. You can reach out to the grant making email address and we'll connect you to the right person. We're more than happy, to help you. It's very easy to move resources, assets that are in your existing fund at EBCF. It's a very simple transfer to our COVID fund, but you can also donate, outside resources, stock, complex assets, obviously cash. So it's been an outpouring of generosity. I've just been tremendously, again, overwhelmed and inspired by what's happening. And I've also seen a significant portion of the individual donors. I would say about a quarter of them have been new folks. And I think what I'm hearing from folks is that it's really, it's the friends and family members of you all. So when you forward our emails or when you talk to your neighbors and your family members on Zoom calls and you talk about how to get involved right now, I encourage you to mention EBCF's fund because the word is spreading. And the more we can share with our networks, our personal networks, our professional networks, information about this fund as a real option to get involved and not feel so isolated and have some agency and really rebuilding our region and making it stronger than ever. The more we can get that word out, the more resources we're going to raise. And if you have an idea of an individual or a corporation or a foundation that you think we need to be talking to, I'd love to hear from you. So please get involved. And if you have the capacity to give again, I beg of you, please consider giving again. The need, I can't stress enough how much bigger the need is compared to what we've raised. So I'm going to keep, and the team, I want to really call out and shout out the development team and my colleagues Sachi Yoshi and James, as well as the CIP team and our donor services team and the hard work to, we're pounding the pavement virtually to raise the much needed resources. And I want to also say that this is our #1 focus as a foundation right now. In terms of, I know there was also a question about whether we could advise people on giving directly to nonprofits or giving into the fund. I say do both. That's my approach. If you have the capacity, please consider doing both. Again, the need is so far outpaces what we can all raise. But if you have a very deep and trusted relationship with a nonprofit, I guarantee you they could use the support. And so you may want to start there. If you'd like to have a broader, impact in terms of supporting both counties, Alameda and Contra Costa, then, or if you really would like us to choose the organizations and you trust EBCF, then I encourage you to go through our fund to start. So
yeah, I think Paula and Tom really have modeled that. We know that they have both been generous with organizations that they have a history of supporting and that they have relationships with, as well as contributing to the whole fund overall. So yes, I think many of our donors actually have done that. A significant number of our donors have given both individually to specific organizations as well as to the fund overall, in recognition that we might have access and knowledge of more organizations than they are currently in relationship with. Some folks asked, yes, this session will be available. The recording will be available, as I mentioned, and we will provide contact information for Dr. Noha and Ria. So if folks want to get in touch with them. We have a question about how we would analyze the results of our grants. So we at EBCF are really dedicated to building trust-based relationships and long-term partnerships with our community grantees. And that plays out significantly in how we work on kind of reporting and long-term learning with our partners. So a couple of things, each one of the categories that we named will have a slightly different way that we're monitoring kind of impact and result. Particularly around the direct financial assistance. We're going to be doing very simple Google forms for our grantees to be able to give us feedback about how many folks they were able to connect with, the range of those financial supports, how folks may have used those dollars. So we also want to respect the confidentiality of those relationships, but also learn from how resources were used and the types of populations that were in deepest need. In terms of kind of general operating support, that's really about the long-term health and well-being of our organization. So, we just want to see people thrive over the long term. And then really when we look at the results of organizing and community systems change, community-driven systems change, part of analyzing those results are really seeing the new policies that are being adopted and put in place by those grantees themselves. So there, I would stress in terms of the results and the impacts that will be really tracked through our deep relationships and conversations with grantees, both about kind of, we like to be able to understand kind of the numbers and the quantitative pieces. We also want to get into a deeper learning pattern around the qualitative relationships and what we can learn about our own grant making and how to be a more effective partner. We consider that part of the kind of the learning and evaluation of our work as well. I will mention really quickly in terms of that email inquiry, we are not doing kind of a formal massive proposal, again, back to really leaning and trying to be as trust-based with our grantee partners as possible, really just sending a simple inquiry to that grant making at eastbaycf.org is enough. You do not have to pre-write an entire proposal. We will be back in touch with you about that. And then some folks had questions about kind of how money flows and whatnot. We are actually doing grant making every week. And so that's a very frequent kind of check issuing process for organizations, getting money out as quickly as possible. And where possible with folks, we can do wire transfers in order to make sure resources are flowing. Let's see, I think we're about at time for the Q&A. And again, anything that we did not get to in this, we can wrap up in an email to you or follow up individually as we have your contact information. And I'm going to go ahead and turn it over to James again to close us out.
Great, thank you, Amy. Let me first thank everyone for joining and taking time. I know you're all busy and there's lots going on. What I wanted to do actually in closing was to offer a couple of challenges to those of you who have participated. The first challenge actually would be to help us get to $5 million in this fund because we think that the need will be ongoing and is massive right now, and that will continue. I think the second challenge would be, I would really highlight what both Tom and Paula indicated, and that is being bold in your giving. And they have certainly, I think, demonstrated that in how they are now approaching how they'd like to utilize their resources in terms of investments in the community and in the field. The third, I think, would be a challenge to really understand and be mindful of how we together can get through this. And when I say together, I mean that it includes the community, the public sector, the private sector, philanthropy, that we all have to work together to shape what we can do, both during this emergency and the emergency responses, and then also what we will need to do to ensure that there are long-term solutions that allow all of us to have the kind of life here in the Bay Area that, that we all aspire to. And so there's a challenge, I think, both for getting through this emergency response, but also a challenge in building long-term communities that can serve all of individuals and families, and especially those who are most vulnerable. So with those challenges, I want to again thank you so much for taking time to be with us. And I want to thank our panelists and the work that they're doing that is critically important. And they exemplify, how important the nonprofit sector is to serving community and to being a bridge between us and the needs of communities. And so to that end, thank you all for participating. And we look forward to hearing from you and seeing you in the future.